All right, guys, this is going to be an introduction to the nutrition coaching program here at Medical Specialty Clinic. So I'm Dr. Marshall. I'm going to go through rather quickly what this program entails. So the nutrition coaching program is for patients who really want to make a change in their life and be healthier, lose fat, gain muscle, and do that with diet and a little exercise, but really you don't have to exercise a ton. You could also use the nutrition program to be a bodybuilder if you really wanted to bulk up. It's that good. This will tell you how to eat. A lot of my patients, they have trouble finding things that they can eat. They get told what they can't eat and they focus on that, and so they don't really know what to eat. Well, this program will tell you what to eat and when to eat and how much of what to eat. It pairs up with an InBody scanner and then the LifeBase app. You use that to track all your food. So this is not for somebody who just wants to change their diet a little bit. This is for somebody who really wants to change their life and they're willing to put in the work to track their food and check in with the office on repeat scans to see how they're doing so that we can update and make changes to their plan. So this all starts with an InBody scan. So the InBody machine, you can see it on the screen here, measures through electrical impedance. It scans your body and weighs you, and it can tell you exactly how much fat you have, where you have it, how much muscle you have, where you have it, the integrity of the cells, the intracellular water and extracellular water. You can see here extracellular water, total body water ratio, and phase angle. This is a sample scan report here, and this phase angle is very important for the health or integrity of the cells. You can see it gives you the lean analysis. You have so much muscle, how many pounds of muscle you have on your arms, the trunk, the legs. It can track that over time with repeat scans. It gives you a visceral fat analysis. It also can tell you where your body fat is. So just like the muscle on each arm, each leg, and the trunk, it will tell you how much fat you have. And this scanner will tell you an optimal fat amount or percentage for you. So we can tell exactly how many pounds of fat you need to lose to be at a healthy, low fat weight. So that's the scanner. So you get a scan and then you sign up for the coaching program. And basically, when you track your food, I see that. So this is my coaching dashboard. So when a patient or a client signs up and they've paid for the program, they've got the app, they've been checking in, then I can see this and it will give me, here is my InBody. So you can see my weight has decreased and my skeletal muscle mass has increased. So you know if you're losing weight and your muscle's going up, then you're definitely losing fat. So it tracks your compliance with meals. So when you get a scan, it pairs that up with your goals, which most people want to lose fat and maintain muscle. We don't want anybody to lose muscle. So it pairs up your goals, your individual goals with your scan data, mainly going off lean body mass. And then it will help me calculate how many grams of protein, how many grams of carbohydrates, and how many grams of fat you need to have through the day and at what times to help you meet those goals. And you can see here, I track my food for breakfast. Yesterday morning, I had 2 turkey sausage links, 2 walnut halves, 1.5 ounces of chicken breast. I had some multigrain crackers to get my carbs. I had a 1/2 cup of Fairlife fat-free, ultra-filtered, lactose-free milk, 1/2 cup of oats, and a high-fiber tortilla. So that is really a ton of food, but that gave me 35.4 grams of protein, 59 grams of carbs. I'm supposed to have 60, and then 15.2 grams of fat. So very, very close on my macros. Sugar goal is 12. Less than that's fine. As long as you keep the sugar below the goal or at the goal, you're fine. And then fiber, you want to try and get 7 grams of fiber with each meal. I managed to get 17 grams of fiber because of that high fiber tortilla put me well over the top there. And then obviously you want to get 2.5 cups of vegetables a day if you can. Not many vegetables for me this breakfast, but I'll make up for that with lunch and supper. And then monitors your sodium. So those are the macros. So when you scan in, I look at your meals as a coach, and then we determine what we need to change. So you want to scan every 1 to 2 weeks, no longer than every 2 weeks. And then that will give me goals. So my goal is to lose fat and maintain muscle, and it will tell me what you need to do to meet those goals. Like I said, there's my macros. So when you first sign up for the program, you will get a meal plan laid out for you, how many grams of protein, how many grams of carbs, how many grams of fat, and you will eat either 5 or 6 meals. You'll eat every 2 to 4 hours. And so you have breakfast, lunch, and dinner, and then 2 or 3 snacks. There you can see mine. The snacks are lower amounts of macros there, and that's it. If you stick to that and track your food, then you will meet your goals. There's no question about it. The hard part is trying to plug in the right kinds of food to meet those macro levels and do it well with good quality food. So when you do that, you track it, it works. So here is our website here, Medical Specialty Clinic website, our nutrition coaching page. You can go to medical services, and then it goes to a drop down, and you click on nutrition coaching, and take you to this page, and talks a little bit about it, give you some more information. If you click join now to get started, it'll take you to the sign up page. Click on that, and then it'll ask you to answer several questions, and that helps determine your goals. So how much do you exercise, and do you want to gain a lot of muscle, heavy bulk, or do you want to gain a lot of muscle and not much fat? So it can help you do any of the above. You'll get a meal prep guide and recipe packet. So there's all the different recipes. I won't read all those to you. Goes down through it, baked oats, breakfast burrito. So it starts with breakfast. There's breakfast sandwich. So you can do French toast, things like that. You just have to do it smart. Sugar-free syrups, that kind of stuff. And then you also get a nutrition playbook, and that gives you some basic information. Healthy food choices here, talks about good protein sources, carbohydrate sources, so on and so forth. Then you get specifically carbohydrate guide. So steel cut oatmeal is a pretty good carb, groats, quinoa, things like that. You want to keep your sugar to less than 20% of your total carbs. Here's an example of Fruity Pebbles versus oatmeal. Similar calorie, but a whole lot more sugar in the Fruity Pebbles. Grocery shopping list. Protein, carbs, veggies, fruits, fats, condiments. Some good ideas for condiments. The G. Hughes sauces are very good. Really not a lot of calories in those, not a lot of unnecessary stuff. Meal prepping talks about that. Gives you some breakfast ideas, eggs and oats, classic breakfast ideas, and then some Cheerios and some Fairlife fat-free milk, and some whey protein. And then lunch and dinner, chicken, rice, broccoli, a small piece of avocado, obviously a pretty healthy meal there. And then some quick, easy go-to meals, some snacks, quick snacks you could make, a couple of pages of snack ideas, pretty easy to make. Coffee variations. You want to go with the 0 sugar drinks, obviously. You want to avoid regular sports drinks, so on and so forth. Fast food and restaurant guide talks a little bit about there. I wouldn't eat out much, but if you do, it'll give you some ideas on things you can try. And then some other tips. So Here is the app on the App Store. This is just a screenshot of some of the pages on the app, but this is what you'll use to track your meals. So you click on each meal, hit plus, and then you'll add in your meal. There's a searchable database on it, and it also has quite a few different foods in there already. And then you can search, and you can also scan the barcode on the item, and most of the time it will know what it is and it will bring it up. And then you just put in how much of it you ate and then go to the next item. And once you get everything in, hit save. It'll give you a score, and then I can see that later when you track it. So that's the app. That's pretty much it. I hope this helps. And if you're interested in the nutrition coaching program we've got here at the clinic, then just go to our website, medicalspecialtyclinic.com, and click on medical services. Should have a drop down, nutrition coaching. You can read a little bit about it and then click join now to get started. And then there is a fee for the program. I have some discounts if you're interested, but always good to come in for consultation, and we'll get you on the schedule and go through it, get you on the scanner, and then we can set you up with a nutrition program.